Welcome to our video on the end-to-end patient journey in a healthcare practice. We'll cover three phases: pre-consultation, consultation, and post-consultation. The processes that we will discuss are diary administration, debtors and patients, appointments, clinical information, billing and corrections, claim administration, receipting and corrections, debt management, as well as reports and internal controls. Communication occurs during the entire process and happens in most phases. It will be indicated with this symbol. Before any patient can visit the practice must be established with all necessary equipment, staff, and registrations in place. Stock is obtained and recorded in the software to ensure we have the medical supplies we need. Business processes are made to make things smoother, and legal documents are created and shared to follow rules and regulations. One or more people will fulfill the following 8 roles in the practice: the practitioner, the practice manager, the receptionist, the billing expert, the cashier, the credit controller, the stock controller, and the bookkeeper. In smaller practices with fewer staff members, one person may handle multiple roles and responsibilities. Assigning specific tasks and duties to each role ensures that employees have the required skills to contribute to the practice's success. This also helps clarify responsibilities for all staff members based on their respective roles within the practice. In the pre-consultation phase, several key processes take place to ensure the smooth operation of the practice. The first process is diary administration. The practitioner, the practice manager, and the receptionist are involved in the diary administration process. The practice management software is set up to enable efficient scheduling and record keeping. User preferences are customized to enhance the workflow for each user. The second process focuses on debtors and patient management. The practice manager, receptionist, and credit controller are involved in the debtors and patients process. Data processing systems are designed and established to handle patient information securely. The software configuration is completed, allowing us to effectively manage patient records, billing, and insurance claims. The third process is appointments. The practitioner, practice manager, receptionist, and stock controller are involved in the appointments process. Patients have several appointment booking options available. They can book online through the practice website, use the patient portal, call the practice, or use a telehealth portal if available. All appointments are seamlessly displayed in the practice diary. Before their visit, patients receive pre-consultation questionnaires and relevant documents, such as terms and conditions, consent forms, and patient information forms, to fill out. On the day of the appointment, patients arrive at the practice and can immediately take a seat in the waiting room. Now, let's move on to the consultation phase. This process involves the consultation itself. The practitioner is involved in the consultation process. The practitioner meets with the patient and captures and verifies their medical history and clinical information by completing a general examination form and other relevant clinical notes. After the consultation, the practitioner may create a treatment plan or refer the patient for further investigations, such as radiology or pathology tests. If a referral is made, the patient will visit the respective laboratory, specialist, or radiology practice. Once the results are ready, the practitioner will receive them for review. When all the necessary information is gathered, the treatment plan is either created or reviewed. The patient may also receive a sick note, a travel certificate, or a prescription as needed. After the consultation, the patient may receive a service survey to provide feedback on their experience. Additionally, if necessary, the patient can be enrolled in a disease administration management program for continuous care. Now we can talk about the post-consultation phase. The first process in this phase involves billing and corrections. The practitioner, practice manager, credit controller, and bookkeeper are involved in the billing and corrections process. The practice generates an invoice for the services provided. Private patients receive the invoice along with a payment link for their convenience to make a payment to the practice. The second process involves claim administration. The practice manager, billing expert, and credit controller are involved in the claim administration process. The medical scheme claim is sent directly to the medical scheme through real-time switching. The medical scheme can either approve the claim fully or partially. If approved, the practice receives a remittance advice that can be processed manually or electronically. If the claim is rejected or only partially approved, the remaining balance becomes payable by the debtor. The third process is receipting and corrections. The practitioner, practice manager, billing expert, cashier, and credit controller are involved in the receipting and corrections process. Any payment received by the practice, whether through cash, card, or electronic funds transfer, are properly receipted. If the account is paid in full, the debtor account is finalized. The fourth process is debt management. If part or the entire claim remains outstanding, the practice initiates debt collection processes to recover the owed amount. These processes continue until the account is settled, written off, or handed over for external debt collection. The final process involves generating reports and using internal controls to ensure the successful completion of all processes and associated tasks. Through the data captured during the patient journey, the practice can generate a range of reports to gain insights into their operations. These reports offer valuable information on patient demographics, appointment statistics, billing and payment records, and other essential metrics. By analyzing these reports, the practice can identify areas for improvement, monitor performance, and make informed decisions to enhance patient care and practice efficiency. Thanks for joining us on this journey through the healthcare practice processes. If you want to learn more, please visit our GoodX online courses platform.